So, hey everyone, Brian Johnson, founder of Emma Health and the author of Biblical Habits, Unlocking the Power of Godly Wellness. I'm excited to be here with you all tonight and on Giving Tuesday, right? And tonight I'm going to talk to you about something very important in our community, and which is health equity and how it impacts our community and how big it is. But don't worry, I'm also going to tell you how you can get involved. So, first, let's get one thing straight. Health equity is not just this buzzword that you hear in nonprofit boardrooms and feel-good campaigns. It is a real and urgent issue. So if I were to ask you what are the 5 top causes of death in, let's say, the Southside of Chicago, some, will probably say gun violence and things of that sort. You would not be wrong. But if we started at the top of the list, it will be heart disease. Second, cancer. Third, diabetes. Then comes fourth, your homicide, backed up by 5, stroke. Health is killing our communities. So, what does this look like as far as cost and the impact, right? So I've worked in the healthcare industry for many years, 15 going on 20. And one thing that I do know is this: preventative care is always cheaper. If you stay out of the ER, you keep your money in the pockets. But when it comes to communities like the South Side of Chicago, we're not doing a very good job of that. For example, when we look at the per capita, so for every 10,000 people, the ER visits, South Chicago does not compare very well. When you look at some things like adult diabetes, it is 2 to 3 times more prevalent than the state of Illinois. If we look at adult asthma ER visits, it's 4 to 5 times more. If we look at youth asthma, once again, 2 or 3 times more. And mental health is 3 to 5 times more prevalent to have an ER visit because of that. What that means is the limited dollars that we do have in our communities, we're spending them on things that can be managed. Diabetes, asthma, and mental health, these are all very expensive comorbidities and conditions, but they can be managed. But what is the result of us not managing? Not only these heightened ER visits, but ultimately what is leading to is twice as many child morbidity rate. So children are dying. Oh, and adults, guess what? If you live in the South Side of Chicago versus other areas like downtown or the North Side, your life expectancy is 30 years less. That's a 3 with a 0 behind it. Kids are dying twice as fast or twice as much, and adults are living 30 years less. It is a real and urgent issue. So, what is health equity and why should we care? First, let's just define it. It's not difficult. It's just everyone has a fair chance of being healthy, no matter where they live, how much they earn, or how many grocery stores their neighborhood does or maybe does not have. And if we're honest, these underserved communities, all the odds are stacked. The chronic diseases, the stress levels are through the roof. People are struggling financially. People don't have access to care. People don't have insurance. You name it, we got it. And largely, it's not because people don't care about their health. It's really because the system doesn't always care for them. So, we could take action, but first, let's look at the cost of inaction. I was devastated when I found this out. That every 4 minutes, someone in America dies because of health inequality. And that's not a number. That is someone's parent, child, or friend. And the tragic part is most of these are preventable with proper access to care and guidance. Proverbs 31:8 says this: Speak up for those who cannot speak for themselves. Ensure justice for those being crushed. That is what we aim to do. I live that in my life, and I want you to join me. So I told you that I'm the founder of Emma Health. So what is this thing, Emma Health? Well, Emma Health, what we're doing is we're striving to close that gap. Really, this is what we say. We say, well, what if sticking to your health and wellness goals, tracking and communicating with your care team was as easy as having a conversation with a friend? Because Hi Emma is a voice-based health assistant, your personal health assistant, focused on one thing and one thing only: you, your health journey, and being able to create your wellness story. So how do we do that? Well, it's easy. We focus on just small conversations throughout the day to get the most critical and influential touch points that we can. Starting in the morning, your morning routine. So how did you sleep? And get your day started right. What are you eating? Are you fueling your body or are you poisoning your body? Are you following in your maintenance? Are you following your doctor's orders? And are you getting your exercise in? How are you feeling? And are you staying connected to those who care? And last but definitely not least, your bedtime routine. Because how you end today and prepare for tomorrow makes a huge impact. And especially, you gotta get your sleep. So how do we do this? Well, imagine you wake up, or you're not awake yet. You're just in bed, you're sleeping, and you hear, we'll call it Jasmine. That's one of the people on the team that I work with, DC Impact. Sorry, Jasmine, if you see this, but I love you. So Jasmine, sleeping, and you hear, good morning, Jasmine. It's 6:30. How'd you sleep last night? Ready to start your day? Jasmine just looks over and says, no, 15 more minutes. Emma says, okay, I'll let you know in 15 minutes. 15 minutes go by. Hey, Jasmine, it's been 15 minutes, 6:45. We really got to get our day started. I want 15 more minutes. I understand, Jasmine, but instead, could I suggest maybe we just do some morning meditation or listen to your prayer for the day? And then we can just get started with some exercise and get the day started. Okay, we can listen to my favorite song and some meditation. So that's how the conversation starts. Then throughout the day, Emma checks in, whether it be on your smartphone, your smartwatch, or I don't say it in my house, the A word or the G word, the smart assistant, right? Because they're listening. And you can just have these little conversations. And with AI and the technology we have today, everything is tracked. And that is what Emma does. It takes these small, simple conversations throughout the day, checking in with you, adjusting to your habits and your needs, and then it compiles it the way that you need so you can share it with your care team. So throughout your week, throughout your day, you're taking these small little points, but now you've got the big show, right? It's time for your 15 minutes with the doc. Normally, if you're like me, so what's happening? Oh, I'm good. My knee hurt. That's about all the information I have for them. No more, not with Emma. Emma takes this information that you've been compiling and tracking your habits, and it summarizes it and sends it over to your care team. So now you're empowered to drive that conversation. It knows how you've been sleeping. If on Wednesdays, you don't sleep as well, or, your knee hurts every Wednesday. I don't know what it is with the knees. I'm getting older, right? But all of these things, it's not easy right now. Yes, I can do my fitness and get a bunch of different numbers, or, my fitness pal and type in stuff, or even add my chart. So when I go into the doctor, it tracks my medication. But what about me? My daily habits. One thing that you may not know is 80%. 80% of your health and your wellness is what happens outside of the care facility. So that's not when you're at the doctor's office. That's not when you're in the hospital. That's not at the chiropractor. That's not at the gym. It's the times in between. And that is what Emma does. So, what is this? We're going to have information, right? And what's the power of information? Well, I mentioned it empowers, right? Peter Drucker says, what gets measured gets managed, and what gets managed gets improved. Well, I say this. Health is wealth. If you check your bank account, you might be checking your bank account, but do you know the balance of your health account? The community. What are you talking about? See? You are unique in your habits, but there's someone else with very similar habits. You need that encouragement. And then what we're collecting as a community is we will have the data to impact. And what does data to impact mean? That means right now when the studies and things are done within health, very rarely are people that look like me from where I'm from involved in those studies. One of the things that you may have been is the recognition of Black women with the AI recognition. They just simply did not have enough Black women in their study who trained the model. So it just didn't recognize Black women. Yeah, we're not going to let that happen with our health, which is our wealth. So, don't want to scare you, but I do need to inform you. Because these are some real situations that are happening every day. A grandmother having to choose between buying medications or groceries. A single parent skips their doctor's visit because they can't afford childcare. A working professional can't take off work for preventative care. So they wait, and now, boom, you get this emergency ER visit. But think about this. It's a reality check, right? What is preventative care? These minor health issues, unchecked, become those ER visits, giving us our 2, 3, 5 times more than the state and national average. Chronic disease, right? These don't come overnight. These are conditions that, unmanaged, eventually lead to the diabetes, eventually lead to the asthma, eventually lead to the cardiovascular issues. And the working days loss is real. If you're an hourly worker, you may or may not have insurance. So you're telling me I'm going to go spend the little bit about my check that I can't really afford and I can't get paid? And when you do go, we've all heard the horror stories, right? Where someone needs a transplant or something like that, and it's the bankruptcy. Well, many of these things caught early can be managed. And so there is some technology out there, right? I admit it's the Fitbit and the MyFitnessChart, MyFitnessPal, MyChart. But the truth of the matter is 1 in 3 Americans struggle with the getting online, accessing these records, especially the elders in our community, the ones who are the most vulnerable and need this most. They're not as computer savvy as, they need to really, truly embrace these technologies. And that, my friend, is why Emma talks to you. Everybody can talk. Everybody can have a conversation. What we're doing is removing those barriers that will allow us to close that technical gap. And the good thing for you and me is it's a ripple effect. When we solve health inequity, children miss fewer days. The parents miss fewer work days. Communities become stronger, and the health cost for everyone goes down. We are managing, right? We're checking our health account. So, this is the good news. With Hi Emma, you get your health guidance 24/7. Language barriers, it's easy with voice flow, and it's easy with Emma. Habla español. Complex health information, no longer need to worry about it. You talk to Emma in plain language, it'll translate for you. And prevention becomes a part of your daily habits. So, what do I need you to do? I need you to go out to www.healthine.org Emma, E-M-M-A, health, healthapp.com. That's www.emmahealthapp.com and register. Because the more people that we have registered for Emma Health, the more as I go out and I'm talking to the different health partners and the Black Nurses of Chicago and University of Chicago Health and these different organizations, it really helps to say, hey, this is something that the community cares about. This is something that we are looking to invest in because we want our community to be healthy, and we're looking for health equity, and we acknowledge that using the tools and the leverage that we have, AI, technology, just talking about it, our community, that we are stronger together. So, in closing, two things. One, I want you to see it. I really want you to see it. A zip code that no longer determines your life expectancy. Imagine quality healthcare guidance in your pocket and wherever you go. It's not a privilege, it's a right. And that is not a dream. At Emma Health, we are building High Emma, one conversation at a time. Now, a specific note for everyone who does watch this and comes to the end, this is the special note. Tomorrow, you can do this, gratitude. In my research and studies, one thing that I found, anyone who's ever written a book, and anyone who knows, if there's one thing that you can do in the morning is gratitude. So I challenge you here, tomorrow morning, just take a minute or two before you get out of bed and think of just three things that you're grateful for. Try to make them things that you did not purchase. I use my family, the fact that I'm breathing, and I'm still feeling good. You know, that I can come out here and share this information with you so we can make our community better. I am grateful for that. I am grateful for my wife and kids. I am grateful that I've had a beautiful family and friends that have nurtured me along this journey. So I can step out and use the information and the skill sets that I have to make the world a better place. As you can tell, yes, I've got lots to be grateful for. So in closing, once again, this is the call to action. I want you to do this. Go out there, go to emmahealthapp.com and invest in yourself, invest in your community, invest in Emma. Thank you for your time. This is Giving Tuesday. So your favorite charity, we have BSV Ministries. That's www.bsvministries.org. Please go out and donate there. That's my nonprofit, which is helping get health equity education, affordable housing, you name it. We are working with seniors. We're working with vets. We're pulling together the resources of our community because we are stronger together. It's called extending the olive branch, meaning that we are all connected. And the better that you are, the better we all are. Thank you again for your time. God bless you and good night.